That's, sort of kicking off a series.
I'll let you do your stuff.
Yeah, I'm just turning stuff on at the moment. Okay, if you guys are on virtual, we'll get started in just a few minutes. Could someone type in the chat that you can hear me okay? Or give me a little thumbs up icon if you can. Yep, okay, thanks, Allie. We tested all of this 30 minutes ago, so I promise it did work beautifully 30 minutes ago. Secretary Carey, we'll get to you just a few minutes. Thank you so much for joining us. People are still filing their way in. Uh-huh. Yeah, I think I've gotten them in. Okay.
Yeah, you're gonna sit in that chair right there. I think everybody taking a seat. We're gonna get ready to go ahead and get started.
And I was telling people as they were coming in, can't do like church and sit in the back. I gotta sit closer. And I know we have some virtual link as well. If for some reason you can't hear us, just put that in the chat. First and foremost, thank y'all for coming. Isn't it exciting to just kind of be back in person and gathering and socializing and seeing each other and seeing people and connecting again? I mean, you know, for those of you virtually, I'm going to identify you all by your square boxes on your screen. So thank you guys for coming out. We appreciate it. I want to take a minute and thank John Tyler Community College for sponsoring today's event. They've been a chamber supporter probably as long as we've been around. Fred Taylor is on our chamber board of directors and has been supportive in many of our programs prior to Fred joining the chamber board. Ted Rasfeller, Dr. Ted Rasfeller, John Tyler president, was on our chamber board. And we're just fortunate to have community partners like John Tyler be committed to the direction that our chamber is going. We're moving forward. We hope we're helping you go forward with us and building a better path. So thank you to John Tyler Community College. I know they're taking enrollments. I'll tell a quick story that is related to healthcare. When COVID first hit, my daughter was furloughed, and some of you may have heard from her position, and we knew that that furlough was going to be more permanent just because of the industry that she was in. And anybody that knows me knows you got to work. So I said, you got to do something. What are you going to do next? You got to figure out something else. This job is not going to be there for you for a long time. And so John Tyler, through their partnership with BCWA, had a series of certificate programs. One of them was the pharmacy tech. And my daughter virtually in April began her online classes at the pharmacy tech. She finished those classes up. I think they were 6 to 8 weeks, something like that. The program afforded her an opportunity for her to take her state boards as well. She passed her state boards. She was able to get a pharmacy job before she passed her test. She's currently employed at CVS full-time. She was part-time. They promoted her. They liked her so well. They offered her a full-time position. And she now has a career pathway because of the opportunity of John Tyler. So thank you for that. I'd love to maybe come up, Fred, and tell us a commercial or story, but I figured I'd get my personal anecdotes.
Much better coming from you.
Next, I'm going to go through and talk a little bit about each of our speakers. First, we're going to have Secretary Daniel Carey talk to us for a few minutes about the state of healthcare in Virginia and Chesterfield. He's joining us virtually. Secretary Carey was appointed to Secretary of Health and Human Resources by the governor back in January of 2018. And I don't know about 2018 seems forever ago. Prior to that, Secretary Carey was a cardiologist and served as Senior Vice President and Chief Medical Officer at Centra, where his responsibility included information technology services, patient quality, safety efforts, and performance improvement initiatives. I am certain Secretary Carey could have never fathomed a year like the year that we just had in healthcare and human services. So I appreciate him taking time out of his busy day to join us. I also might add, Go Who's. He's a graduate of UVA and Harvard Medical School, and he received a Master of Healthcare Management from Public Health. He served 15 years in the U.S. Air Force. Thank you for our service. And he's been active in the reserves as well. So thank you so much, Secretary Carey. And then after we hear from Secretary Carey, I will come up and our panel.
In the meantime, for those of you that are with us in person, I want you to continue to eat. I want you to enjoy your lunch. Once you finish your salads, staff will come in and clear your plates and bring you your entree. So I just wanted to give you guys some direction for what your expectations. Thank you so much. Okay, we're going to turn over.
All right. First of all, can you see me and can you hear me? I'm getting nods. So thank you so much, Danielle.
Yes.
And really very good. Appreciate that very warm introduction, and what a pleasure it is to be, albeit virtually, with you all today. And I'll just from the top, I will simply say the trends are good. I'm very pleased with where we're heading in Virginia. In fact, we're getting close to many days less than 1,000 new reported infections for Virginians each day, and really exciting. As a state, we went below 5% positivity with our COVID-19 tests for the first time in a while. So I'm really excited about that. And also, we went over 6 million doses in for the state controlled doses, and if you add the federal controlled doses in Virginia, we're up almost to 6.5 million doses. Well over 55% of eligible adults in Virginia have been vaccinated. And I think we're going to start seeing that with the continued downward trend in infections. And I'm really excited. I'm not with you today, but we are now under CDC guidelines able to get together with other vaccinated individuals that are fully vaccinated in small groups without masks. And this weekend, it was great to just put some steaks on the barbecue and have another couple over that were also vaccinated. And I wish that for all Virginians as soon as possible. And please get vaccinated if you're not already vaccinated. I will also, again, say thank you to the Chesterfield Chamber of Commerce. I did one of the first vaccine sites that I visited was in Chesterfield. And I will tell you, it was just so heartwarming. It really was a place of joy. Volunteers, those getting vaccinated, our firewomen and firemen and EMS folks, the paramedics that were ready to transport anyone that had a reaction, the professionals that were there, and it was really just so impressive. And that really is, for me, the place. In fact, I'm a volunteer vaccinator, and I went, well before I got my own vaccination a month or so ago as part of the bottom of 1B here in Richmond. I would go and do vaccinations on Fridays just because it was kind of my mental health day to see that joy and that hope around the Commonwealth, be it in Chesterfield or Hanover or Charlottesville or in Wise County or Virginia Beach, you name it, Petersburg, Chesapeake, et cetera, just really coming together with a commitment to do what we really know will get us beyond this pandemic, which is getting everyone that can safely get the vaccine, which is essentially above 90% of us getting us vaccinated, and obviously children below 12. But we're waiting for more data. Hopefully we're waiting for FDA approval for those who are 12 to 15. And hopefully by the end of May, we'll have direction from the FDA and the CDC on that. So again, just a quick, I want to go over a little bit about vaccination, which I add to what I already have said, and a little bit about trends, and then talk really about where we are with healthcare, where the American Rescue Plan Act also puts us in, and where the Northern administration is going with our continued goal of making a healthcare coverage and therefore healthcare more affordable to all Virginians. So again, I mentioned, please get vaccinated. Vaccinate.virginia.gov is a great site that's got also a connection with Vaccine Finder. You can go in there and connect to a pharmacy, or you can go in there and, if pre-registered, register with a local health department. So, and there's a call center for those that prefer talking to a live human being, 1-877-VAX-IN-VA. And we are really excited about what that has meant to help a lot of individuals, especially seniors that may not be as tech savvy, or those with with hearing. Those are the deaf and hard of hearing that use American Sign Language. We've got that covered 100 languages. So please get the word out about that. We hit those numbers threshold that we talked about. And again, vaccinefinder.org, really a third of the doses go through pharmacies. And right now throughout Virginia, like throughout the country, there are doses available. I know you can get appointments this week to get vaccinated. So we've just really got to continue to get that push. That's how we're going to get through this. So what are the case trends? The virus changes all the time. So we do expect new variants of the SARS-CoV-2 virus as it spreads and as it still continues to circulate in the community, which is one of the reasons we really need to get everyone vaccinated to get our case rates down. So that petri dish of variants coming out is really dependent about how much the virus is replicating in the community. So the less spread, the less likelihood a variant will develop or the variants will spread further. So that's really, really important. So again, the way that we get out of this is with both preventive measures that we know about and also with the vaccine. So again, with the CDC has encouraged outside, if you're alone outside or with members of your household, and if you're vaccinated, you don't need to wear a mask. If you're around people who are also been fully vaccinated, you can get together in small groups and not use the 6 feet distance and a mask. And again, as I mentioned, it is a breath of fresh air and just a sign of what we're going to be when we get this well behind us. So in terms of the continuing mitigations, it means getting vaccinated, we talked about, wearing a mask correctly, staying 6 feet from others, avoiding crowds and washing your hands. But also, if you have been vaccinated, there are additional relaxations that are available to you. So we are committed to recommending that we follow the CDC guidelines as they evolve, as the virus gets lower in the community and as more and more people get vaccinated. But there's always going to be more caution for those that are not vaccinated. So really, there's a great benefit, both practical to the individual as well as to the community, for getting vaccinated. So recently, Executive Order 72, that was the major mitigation order that the governor put forward, and there's been now the 5th amendments, and amendments are happening as frequently as the governor sees fit as new information becomes available. Most recently, because of what I mentioned, the direct increase in vaccinations and decrease in cases, the governor announced the amendment that expands the capacity and social gathering limits for a variety of businesses and venues across the Commonwealth. So that's available at the governor's executive order site. And beginning May 15th, indoor entertainment and public amusement venues will be able to operate at 50% capacity or 1,000 people, up from 30% and 500 people. Outdoor venues will be able to operate at 50% capacity, up from 30%, with no specific cap on the number of attendees. Again, we're following the data and we're putting forth relaxations in those restrictions as quickly as we safely can. And we do learn and follow the cases as we open up. And as the governor indicated, come June, where we expect to be with regard to vaccinations, if things go as planned, we really hope to open up a great deal further. And that's a good thing. And the number of spectators allowed at indoor recreational sporting events will increase from 100 to 250. This is on May 15th, or 50% of capacity, whichever is less. And outdoor recreational sporting events will increase from 500 to 1,000, or 50% capacity, whichever is less. Restaurants should see an uptick in business, or they're able to return to selling alcohol after midnight, and dining room closures will no longer be required between midnight and 5 a.m. And the maximum number of individuals permitted in a social gathering will increase to 100 indoors and 250 people for outdoor settings. And social gatherings are currently limited to 50 and 100. So that's a significant increase and should allow for a lot more safe interaction as we all want to get back to. And these changes are good news for Virginia as a whole. We also know that there will be a comfort to businesses that saw decreases as a direct result. And we know that the hospitality and travel industries have been hurt amongst the most severely in Virginia and across the country. So this is important news. And again, it's careful easing of restrictions as we follow the data, committed to health and safety, but also understand the needs of employers, the needs of workers, as we want to get back to a much more normal environment. And we also think higher ed will help lead the way as they go back to person, as many have already in-person instruction, but also more so as they look at more and more of their students and staff and faculty being vaccinated. Now, what about the American Rescue Plan Act? Now, the ARPA is soon to be another tool in the Commonwealth's disposal to put this pandemic behind us and bolster our recovery in both the economy and our health systems. It includes a number of provisions that will be of great benefit to the state of healthcare in the Commonwealth of Virginia, just to name a few, and I'll list a few. Additional funding to strengthen the Commonwealth's COVID-19 response through vaccinations, testing, and treatment. Funding to expand our public health workforce, especially community health workers and outreach workers, to making sure that those that are particularly vulnerable and having difficulty with access will get access into vaccination and treatment as needed, as well as additional mental health block grant funds and substance abuse block grant funds that states can apply for. And also the American Rescue Plan seeks to enhance health equity by closing gaps in medical care, investing in community health, and addressing social contributors to health challenges, those social determinants of health, like access to transportation, nutritious food, and secure housing. And all of this will lead to a stronger and more equitable healthcare landscape for Virginia. Since the beginning, as I mentioned in my introductory comments, affordable health coverage has been at the forefront of Governor Northam's agenda. And the General Assembly passed and the governor signed into law several pieces of legislation that will go a long way towards achieving some of Virginia's health goals. This year, we enacted the facilitated enrollment program similar to that of Maryland and Colorado, which aims to reduce administrative barriers and make it easier for individuals to know what insurance affordability programs they are eligible for by using tax returns to identify those that wish to obtain coverage and streamline the application process, again, in an opt-in format. So again, it's often unclear whether you're eligible for Medicaid or whether you qualify for subsidies within the marketplace, and facilitating that and doing outreach for folks who are really often trying to just keep houses over their head and food on their children's table. And it's hard to know those rules as one's income changes. COVID-19 pandemic has also exposed a vulnerability in Virginia's health system coverage, as thousands of Virginians lost their coverage due to the pandemic-related unemployment. And facilitated enrollment would support individuals in maintaining comprehensive coverage through such transitions. We also need to address affordability in the commercial marketplace for those whose incomes are too high to qualify for Medicaid, but for whom meaningful insurance coverage is cost prohibitive because of high premiums, high deductibles, or high cost sharing. Many of these individuals are sole proprietors, small business owners, women and people of color, frontline essential workers who do not have access to employer-sponsored coverage. And we are looking closely at Virginia's population and what market trends are telling us, and learning from other state models to make recommendations for a Virginia subsidy program that addresses coverage gaps. And that's part of an important work group, both on reinsurance in the individual marketplace, as well as how do we target subsidies to be most effective to allow individuals who, again, don't have employer-related insurance, but make too much for Medicaid, which we want. We want folks to get good jobs that pay higher incomes, and as they lose benefits within Medicaid, we'll make sure that they can navigate that space effectively and not lose coverage. Those gaps are really devastating to continuity of care, as well as to keeping people's preventive and chronic disease management in place. We know that individuals in Medicaid and in the individual market often experience income fluctuations and can easily fall off coverage due to changing eligibility. As Virginia transitions to a full state-based marketplace, we're working closely with the Health Benefit Exchange to ensure that we coordinate these two systems to reduce the impact of churn that Virginians can get, and the impact of churn so that Virginians can get and keep that comprehensive coverage, regardless of the affordability program in which they're currently in. We work closely with the General Assembly to develop a reinsurance program that I mentioned that can drive down premiums in the individual marketplace by 20%. As a result of the 2020 session, and with support from the General Assembly and our partners at the State Corporation Commission, the Bureau of Insurance and the Health Benefit Exchange, Virginia is now a state-based marketplace on the federal platform. And now we in Virginia control our own enrollment data in real time to inform our outreach and enrollment efforts with expanded navigator programs that have the capacity to do the job better and can target resources to reach Virginians that need assistance and help them choose a plan that best meets their individual and family needs, as well as to do that final enrollment. And when we transition to a full state-based marketplace in 2024, Virginia will have the ability to make additional policy decisions to stabilize and control our own individual marketplace, again, to better meet the needs of Virginians and those that don't get employer-based insurance or government-sponsored insurance. So we are all working together to make Virginia a place where all can grow, learn, and thrive. And I'm proud to work alongside such accomplished leaders as those here in person and virtually. And I look forward to our continued partnership. And again, just as I close, there have been tremendous lessons, and I bet it's going to take years for us to fully realize what are the lessons from this pandemic. And of course, it's not over, so there may be indeed further lessons still. But for me, I've been so impressed by the resiliency and perseverance of our state workforce, of our healthcare providers, of our leaders, leading with such profound and prolonged uncertainty is incredibly difficult. I know that personally, for dealing with when we didn't know where to get PPE and didn't know how to get testing going, and not having pipettes and all the other equipment, and really not getting much support from the federal government. Really challenging times. And I think we've all faced that trauma. And I think together, and I see it at the vaccine sites, that we can turn this traumatic event, not to post-traumatic stress disorder, but with leaning on each other, leaning on the lessons learned of what incredible alignment and collaboration can mean, that we will indeed have a post-traumatic growth experience and learn even more deeply that we are in this together, that when institutions, local governments, health departments, higher ed, localities work together, we can do incredible work. And we've seen that in Virginia, and we've seen that in the last 100 or 150 days here across this country. So thank you very much. I really appreciate the opportunity to share some remarks with you, and I believe participating in a panel going forward. So thank you so very much.
Thank you, Secretary Carey. Before I introduce our panel and moderator, this is part of our State of Community Series. And this is our State of Healthcare. And so when you bring community and healthcare together, John Tyler seemed like the most appropriate sponsor for today. And I'll talk a little bit about their nursing program. Every Friday, you've probably seen a news story or two on any of our local Richmond stations covering the line. If you're familiar with where their location is, that line has gone essentially from the Walmart stoplight down to Brandon Road going into Chesterfield. Now, they've manipulated the line a little bit these days to take it around back, so it's not directing traffic. But any Friday that you go to volunteer at the Chesterfield Food Bank, you find nothing short of a dozen or more John Tyler nursing students volunteering their time in their scrubs, either helping getting families registered or pushing carts delivering food to those clients. I probably volunteered 90% of last year, every Friday. Those students came out with their team leader, 3:30 to 7:30, 8 o'clock at night, volunteering their time to help serve the critical need that is food scarcity. So when you talk about community and healthcare, and I'm sure those students when they complete their program may potentially end up at one of our healthcare providers that we have here today. So I just wanted to recognize the community support that they provide out in the community with their nursing program. First, I'd like to take a minute and introduce Joe Wilkins, who's the CEO of St. Francis Medical Center. Joe's originally from Halifax County, Virginia, attended William and Mary to receive his bachelor's degree on kinesiology. How bad did I mess that up? That like way back. Prior to going to VCU and getting his master's and doctorate in physical therapy. Joe and I know each other from one of his former hospitals. He was the assistant CEO at Southside Center, and we worked on a few community programs, a couple summers. There were a rise in cases of infants being left in the back seat of vehicles. The parents that sleep and a parent may have forgotten that their kid was in the car seat. And so he worked with, we had little decals. You remember that? We had little decals that we worked to get out to businesses and employees so they could remember to check their back seat before they got out. So Joe was working in the community, doing his part to help on this very sensitive subject. So Joe and I go back a few years when I first came to the region. After leaving Southside Regional Medical Center, he had a stint in West Virginia and some of the healthcare facilities there, and then came back home. I'll say come back home to be the CEO at St. Francis Medical Center. He's been married to his lovely wife, Tanya, for 20 years, 3 beautiful kids. So Joe, thanks for joining us today. Zach McCluskey serves as the CEO of Johnston Willis Hospital, and he's been there since December of 2016, responsible for their strategic growth, their day-to-day operations, and the campus at Chippenham Johnston Willis Medical Center. Zach came from Parham Doctors Hospital, where he served as CEO there back in 2014. During his tenure at Parham Doctors Hospital, admissions grew and earnings grew 37 to 41% respectively. He's recognized as, Parham is recognized as one of the top 5% orthopedic hospitals in the nation. Zach is a Richmond native with over 10 years of healthcare leadership experience within the HCA health system and following a career in nursing. And so that patient care is in his bones when you're a nurse. Zach received his bachelor's from VCU and his master's in health administration also. So thank you, Zach, for joining us. Audrey is our moderator for today. And so Audrey Trussell is the Vice President of Community Impact, which I think is very fitting. When I met Audrey, I was serving on the board of United Way, and I digress. She's Vice President of Community Impact at United Way. So, and Audrey was heading up the partnership of communities and schools in Petersburg. And if you know anything about schools in Petersburg, it takes the community to add support there. And so it was a true village approach. You had many, I think at one point, 30 to 40 entities working to help do their part in Petersburg schools. And she sort of cultivated that network of community there. And so it was very appropriate for her to be the vice president of community impact for all of the She leads the community impact team, which focuses on implementing United Way's 4 strategies across the Steps to Success program. The community impact team takes the lead on those strategies and research funding and convening systems of change. And Audrey has a master's in public administration. And so when you think about the work that she's doing at United Way, when you think about what's the greatest need and where do you put those funds to serve the greatest need, United Way is really focused on getting the research and data to support how you can make the biggest change in impact. So it seems quite fitting to have Audrey come up and about for you all bring up our group.
Ready to jump on in? Let's do it. All right, we're just going to get into it and get into the conversation. So thanks for joining us today. I'm really excited for everyone here and online to learn more from Zach and Joe. I got a little teaser of this when we met to prep, and the information that we're about to hear today is really valuable for not only understanding what's happening in the community, but how you can be a part of it and how we can all come together the state of health in Chesterfield, in the state, and in our nation. So for this one, we're going to start first with Zach, and then we'll move to Joe. The community, including hospitals and health organizations, has experienced substantial change since Governor Northam declared a state of emergency on March 12th in 2020. What challenges exist now that didn't exist last year? And what lessons has responding to COVID-19 taught healthcare leaders that you will use going forward?
Oh, thank you. And thank you all for being here. We really appreciate your support over time, and the organizations represented here have truly been a part of our community and our response. So thank you. So we could spend all week here talking about lessons we've learned over the last year as health organizations. And before I get into specifics, when we started our pandemic response, we were fairly early within our organization on dealing with COVID patients, because we have 190 hospitals from the West Coast, East Coast, London, all over Texas, Florida. It's a very diverse geography. So I remember having a conversation, a call with our health system CEO, and he said, look, we have some 4 main objectives that we're going to focus on. First of all, we're going to keep each other safe. We're going to keep our healthcare workers safe, our colleagues, our physicians, those that interact with us. We're going to keep them safe. That's our first mission. Our second mission is to take great care. So we're going to provide exceptional care for our. Third is we're going to learn from this. We're going to learn from one another. We're going to share stories. We're going to share best practices. Finally, through all those things, we're going to become a stronger and better health system. So that was really our foundation. That's where we started thinking about our approach to. Some of the key lessons you heard Secretary Kerry talk about these are, one, how do you care for people differently, right? So before this, we didn't really have a world where we couldn't have visitors in the hospital because of the risk of them bringing sickness into the hospital, vice versa, and becoming sick in the hospital. So how do you communicate and care for people that can't communicate for themselves? So we had to get really good at that. We had to get good at communicating with loved ones, giving progress updates. Oftentimes, it's a complicated story to care for something. You need a lot of history, a lot of physical exam, a lot of medication history, things like that, in order to really get a good treatment. A few other ones, and I don't want to take all of Jim's thunder, but resiliency in our supply chain for PPE and testing equipment. we had to reimagine how we were going to get supplies to care for everyone. Had their, their orders in, or all had to protect one another. We had to get better at sourcing, we had to get better at manufacturing. So one of the things that we've done as a company is begun manufacturing masks in Asheville, North Carolina. So those are a few of the things that we learned, and we continue to evolve those over time. So each phase of the pandemic taught us a lesson, and we just put those in the playbook.
And definitely Zach and I have a lot of similar experiences. Taking care of property. We learned so many to learn these lessons. One of the lessons is just how flexible we are as we've been able to flex so simple comes to me. Because in the early moment, things change. Our stand as leaders trying our very best to communicate. And honestly, told the message. And it's challenging, but definitely it's frustrating. However, at the end of the day, our goal was to take care of that was always. And in doing so, we learned a lot about ourselves. Will say that PPE stands typically in healthcare, most businesses have this just-in-time mentality where you want your supplies just in time. However, when we came to the pandemic, we're running out, and so we have to change that mentality. And now we're making sure that we have enough to last us. That was a huge change from something. And also from a care standpoint, something we've learned is looking at patients from a primary care perspective, that they need to have their care. In order to have that care, we have now telehealth possibilities for so many patients. And that's the thing. But we need to make sure that our patients are taken care of where they are. Because during the height of the pandemic, they weren't going out to them. They weren't going to see their providers as they needed to. And eventually what happened, they showed up in our community and they were so decompensated that it was very difficult at times to get their help. So that was the goal, to take care of patients.
Joe, I'm going to interrupt just for a second. I'm going to get you to hold your mic slightly closer when you respond so that they can hear you virtually. They're having some issues hearing.
Thanks, Joe and Zach. And I think what rings true in that is even before the pandemic, through the pandemic and beyond, the patients come first in your organizations and in your persons. And your flexibility and resilience in this space is part of your dedication to that. So thank you for dedicating yourself to the community and making sure we're all healthy. We're going to dive a little bit deeper into the pandemic and also talk a little bit about some of the insurance issues that Secretary Kerry spoke on as well. In United Way's equity data series that we just released focused on healthcare, we use data on insurance coverage to identify inequities in our service area. We found that Hispanic individuals make up 11% of the population, but 25% of total uninsured. Black individuals make up 19% of the population, but 22% of total uninsured. These findings are pre-COVID, so we know that there's going to be some upticks in that equity gap after the fact when we have that data to calculate and put out, and look for it on our website when it comes. The pandemic has emphasized what we already knew. Our healthcare system faces inequities that favor some groups while unfairly disadvantaging others, such as Black and Brown communities, people living in rural areas, and people who are unable to access health insurance for various reasons. How have these problems evolved over the past 12 plus months during this pandemic? But also, what lessons have you learned about ways to close these gaps you can apply now and moving forward. And we'll start with Zach or Joe on this one, and then we'll go to Zach.
All right, thank you. So as we look at our mission among schools, our mission is to extend the compassion and ministry of Jesus by improving the health and well-being of our communities and bringing good health to those in need, especially people who are poor, dying, and underserved. And this is a great question to bring that mission in, because as we know, those underserved communities, it's often been said that when America gets a cold, those communities get flu. And that's absolutely true. And we found that to be true with COVID as well. And so the way we focused on that is, again, just making sure we're in the community and in front of those individuals that need that care. One example I like to give is we do have a caravan that's within our Boston system. And this caravan, it goes out to the communities to bring health care to their residents. This caravan actually is given 3,000 vaccines throughout communities in the area, focusing on some Black congregations, as well as Sacred Heart Center, focusing on our Latinx community as well. So again, the goal is to be in the community and be at the location where those community members are. I can't underscore it enough, is that when you want to ensure a community receives the care they need, you must and we must go to them. And that is the goal, because they're not going to be able to always come to us. And we've learned through the pandemic is that some of the, especially with vaccinations, some of the ideas of staying away from healthcare have now risen again. And from a vaccination standpoint, our goal is to educate why it's important to all these communities to be vaccinated. Not only the reason why, but also to give them that access. And we have to take that burden upon ourselves to go into that, to make sure they have the access to the care that they need. Overall, from a underserved community standpoint, bond scores throughout Richmond market spent $130 million last year on those communities and also different foundation resources and the paying of medical bills that were uncovered as well. So we do that often. During the pandemic, our goal was to go to where they are because they cannot to us. We have to go there and show our commitment.
Thanks, Joe. That's a great story. So at HCA, our mission is to care and improvement of human life. And we don't discern, we don't care what you look like or what your background is. We want to make you better. So that's our mission. That's why we exist. And specific to this question, I'll give 3 examples of things that we've done as an organization to make sure that we are doing our part to close that equity gap in our communities. So there's been a lot of waivers and a lot of things for Secretary Kerry talked about legislation that have made access to insurance programs more available. So early on in the pandemic, we partnered with local payers and national payers like Aetna, with the Medicaid services to make sure that people that were available to receive healthcare insurance had the information, had the tools, and had the resources available to seek that out. So we actively engaged in that. We also we have very generous uninsured and underinsured policies for if you receive healthcare services with us. So if you are at a certain income level, you will never receive grades up depending on your income. And just to put things in perspective across hospitals, last year we provided over $105 million worth of uncompensated care for folks. That's on top of $95 million worth of state and local taxes that we've contributed to the economy as well. So we have a lot of financial resources at stake to make sure that we provide care. Another thing that we've really been focused on is making sure that some receive care in our organizations, that your culture is represented, the culture of our communities represented in our work, in our leadership. Because there's a lot of data out there that says that if you are cared for by someone that understands your culture and similar to your culture, that you're going to receive better. So we have a lot of diversity, equity, and inclusion initiatives in place to make sure that we have great representation. One example, and Joe hit on this, is making sure, and this is something specific to COVID, making sure that people see people like them receiving vaccinations, right? So making sure that our African American physician leaders, our Hispanic leaders, our Asian leaders are talking about why they're receiving the vaccine, why it's important for other folks. So that's just
Fantastic. And Joe, you said, go to where community members are. And I think, Zach, you built on that, not only in going in place, but going in culture, going in the way you speak and the way that you treat others. And that resonates truly through both of your answers. It's fantastic to hear. Thank you. We're going to talk a little bit about unintended consequences of the pandemic. We focused a lot on vaccines and on COVID tests and access in that space. But what we've also heard is that folks aren't accessing preventative care. They're not getting those other vaccinations. So there's a decline in accessing health systems for many reasons. And one of those was the Governor Northam's order prohibiting elective procedures. So that was enacted on March 25th, 2020, and it went until May 1st, 2020. For some of our safety net providers, they saw a really large impact on folks who were looking to get those elective procedures done and got pushed off. And so they're now playing catch up in that space. For you all, what are some unintended consequences of this pandemic, of orders such as this? And how can we, people in the room and in the virtual room as well, be a part of that partnership to change that for communities going forward?
I'll start with that one. And this is something that we're thinking about a lot now as we're in this phase of the response to the pandemic. So as screening services were halted, either by mandate or just out of just having practice, because people not wanting to come to their doctor, come to the hospital, that's definitely created a health issue, right? So typically, you would get your mammogram same time every year, and if you're a certain age, and you'd be able to catch things at an early stage, colonoscopy, your pelvic exam. So these screening services are very important to catch things early. And one of the ways that we measure the effectiveness of our care is, particularly with cancer care, is at what stage are we identifying? So there's a scale from basically 0 to 4, 4 being the highest cancer spread across your body. And we are already seeing that where we're capturing cases as necessarily, but where we're catching things and continuum is progressing up that scale. And this is something that's going to be with us for a long time. It's something that we're dealing with for quite a while. So that's one example of something that we need to respond to. So we've done a lot of education about making sure people understand that it's okay to come to your health organization and receive your screening, receive your annual physical, stay on top of your medications. There are things worse than getting exposed to COVID. We're a comprehensive stroke center at Johnston Willis Hospital. So we provide care for people that are having stroke. So we have clot busting medicines that we give you that can save your brain and save your life. We have tools that we can go in and retrieve clots in the blood vessels in the brain. But all those things are time to you lose millions of brain cells every second that you don't receive care. And unfortunately, that's one example. We see people coming in later in that condition of stroke. So we can't save them. We can't keep them from having a devastating disability. At our heart hospital, Chipping, we're seeing people that are coming in that they had some chest pressure, they had some chest pain, they had some discomfort that 2 years ago they wouldn't have thought twice about calling them to come to the ER, but maybe put it off. We're seeing heart attacks that are creating damage to the structure of the heart. It's basically your person. People that are dying without even asking for help. So these are all things that we got to dig out of through education, through awareness. It's work that we got.
Thank you, Zach. And as we think about healthcare in the Richmond community, we work very well together to make sure that we take care of the Richmond. And of course, we compete, but at the same time, we're here to take care of our community. And we often tell patients, especially if they're having any kind of issues, go to the nearest hospital, whether it's Rossapores or HCA, go there to make sure they can take care of the issues. And through COVID, as I was saying, folks have been putting off their, and because they're putting it off, they're coming in again. There was a stat by the American Diabetes Association that close to half of diabetics in the country have been delaying their care. So by delaying their care and not going in for regular checkups, your disease process is going to worsen. And so there's a fear of going into healthcare systems or healthcare offices. We are prepared. We are really the safest place for you to be. We want to make sure that you can get that care that you need. Also, from the standpoint of bringing the care to our patients, telehealth is something that we've been working on for years. However, COVID pushed us to the brink of activating so many more resources right now. We need them right now because we needed people to be able to access the care that was needed. And COVID, which is dangerous, COVID is deadly. However, don't let the fear of COVID ruin your health. And I say that to me, don't let the fear of going to the doctor, fear of going to the hospital ruin your health because now you're getting worse. To Zach's point, if you have the chest pain, you want to make sure you take care of. And from our standpoint, from the hospital standpoint, we prefer if you not to come to us. We want you to not come to our clinic. We want you to be healthy. That's our goal, is for you to be healthy. And the emergency department is the last resort, and you are now at an unhealthy point in your life. So again, goal is to get upstream, go to your doctor, get regularly checkups. Again, don't let the fear of COVID ruin your health.
Thanks so much. At United Way, our mission is to empower individuals and to drive systemic change to provide everyone with a path to success. And what I hear and what you're saying is the importance of education and advocacy and making sure that we go to the community, like you talked about, to share that information so that folks know what they need to know to advocate for themselves, to take care of themselves before they make their ways. It's great. Thanks so much. So we're going to switch over to the workforce now, talk a little bit about the impact of the pandemic on the workforce. Vaccines have begun to offer hope that the pandemic will end, but another potentially devastating issue looms. By 2030, the World Health Organization projects a worldwide workforce shortfall of about 18 million healthcare workers. In addition, the latest annual PricewaterhouseCoopers Women in Work Index research found that the COVID-19 pandemic reversed women's workplace gains as a burden of childcare rose and female-dominated sectors shed jobs. How have your organizations felt these workplace issues locally, and what strategies and partnerships can we implement to combat the shortfall?
And first, just to comment on the healthcare workers in general. There was a huge lift that our healthcare workers went throughout COVID and continuing now. During especially the beginning, we had workers that were, as I look at it, wading into the unknown to take care of people that they didn't even know. But that's our duty. That's what we sign up to do on a daily basis. We had times where the hospitals were pretty empty. However, we were still waiting for the surge that never quite came. It came a couple months ago. It finally came. But we have these healthcare workers who are uncertain about their own health. However, their duty is to take care of patients. So my hat, my hand, my heart goes out to every healthcare worker provider that took upon that challenge. When it comes to healthcare workers in general, in terms of a workforce standpoint, we know that 2020 was going to be the height of the loss, the height of the shortage of nurses. And it was. The pandemic came on top. Nurses have been in short supply for many years. And now we have a rash of people retiring because of pandemic. And I will say from where we see from a healthcare standpoint, there's a need for nurses, there's a need for programs to make sure we train those nurses. And not only nurses, but of course physicians and medical techs, physical therapists, all healthcare workers, we need them. Because we have an awesome community safety program. And we have an awesome system they can be involved with to help take care of those patients. But I will say the focus is going to come down to partnering with our four-year colleges, with our master's degree programs, to make sure that we can build that pipeline, whether it's internships or shadowing opportunities. We're open to make sure that you can see the impact that you can have in the lives of others.
So the demand on our workforce has just been so incredible. So not only do we have a burden in the hospital where we have demand of people to care for in dangerous situations, and lots of them in many times, we also have the demands of home that we're dealing with. The healthcare workforce is predominantly female, and those burdens are amplified on that. And we've never appreciated that, or at least I've never appreciated that. I can recall making rounds in the hospital, which I love as often as I can. And I saw a nurse, and she just looked just absolutely, just devastated. She just looked tired, and she kind of looked over and said, "What's going on? What can I help you?" She said, "Can you get my son to do his homework?" I said, I could go that one. I can help myself, but is there anything else I can? But she was sitting there trying to figure out with her high school age son at home, doing homeschool, how to keep him motivated, how to keep him moving forward, and all the while caring for patients in our hospital. That it really dawned on me just the magnitude of that issue. As Joe said, we are so fortunate to have great community partners in Chesterfield County, Greater Richmond. John Tyler Community College produces amazing amount and amazing quality of nurses, pharmacy techs, you name it. There's a ton of healthcare professionals that are coming through there. We partner with them on new programs, and we explain what our needs are, and they're very responsive to that. We're also joined today by Galen School of Nursing, which is a new nursing school that's coming to our area. That's a partnership with HCA. So we're thinking differently about, we can't always rely on existing supply of educated folks. Sometimes we're gonna have to go out there and create new supply. So we're trying to be innovative as we possibly can about different solutions to the workforce, but it's gonna be an issue for a while. It's something we're doing. So if any of you have people that are looking for healthcare careers or interested in joining healthcare, it's a great time to do it. They come out, will be in high demand. There'll be plenty of work.
Great, thank you both. And we have that great story from Danielle about, her own family becoming a farm tech and becoming employed at CBS with John Tyler. So thank you to all of you who are making that possible. And I hear a call to lean in more, find those healthcare workers, partner on those pipelines, make those partnerships happen so that we can continue to build that workforce up to support these organizations and our community. All right, here's the big ticket question for you all, and it's not the last one, but it's a big ticket one. What can we, and what are the most important things that we can do as members of the Chesterfield Chamber of Commerce, as members of this community, to reach the end of the pandemic?
Sorry. So, some of this is not rocket science, right? We're brain surgery, use out there. So we've learned a lot, and Secretary Kerry and his team have been really instrumental in this. But let's do our part. As we wash our hands, we wear a mask, according to the guidelines, socially distant, be responsible. We take away opportunities for this virus to spread. It's free, doesn't cost you anything, but it's just a personal responsibility. We all need to be vaccinated. If you're eligible, I really encourage you to be vaccinated. I get asked a lot about, is it safe, effective, why should I do it? I also get asked can you speak to my friend or speak to my spouse about encouraging them to get vaccinated? And I've run out of creative ways. I don't know if you've got a better solution, but one thing I share with them is when we first opened up and we got vaccine at 7 in the morning, we were putting shots in our by noon, by lunchtime. And we had an eligibility criteria tiering system. The closer you were to a COVID patient, the quicker you got the shot. Basically. And the response from the physician community was immediate and it was real. And it, you know, they were in line saying, "I'm ready for my shot. Thank you so much." Right. So what I've started telling people that are on the fence is think of these physicians. The response, and I think the stats in the physician over 90% chose to do that. Think of them as your airline pilot, right? So they're not only saying, "Hey, we recommend that you put on your parachute," they're putting theirs on. And if you've ever flown in a plane and you see the pilot sense of urgency putting on a parachute, he offers you that opportunity, you would take it. This is no different. The physicians are putting on their parachutes. Let's put ours on because it's what we say. Specifically about, you know, what can the nonprofit communities do and what can our organizations do, you know, encourage that, tell that same story, and reduce any barriers that may be in place that you can affect the people receiving preventive care or receiving healthcare, taking care of their families, so they can say. I think that's what's going to be helpful. Some people may want to do these things, but they can't for whatever reason because they're working 4 jobs or they're, you know, just trying to survive or take care of other priorities. If you can help eliminate some of those barriers, encourage people to get these things, we'll be in good shape.
I love parachute analogy. I'm going to use that. I'm telling you, still. But I will say from what the community can do, what you all, number one is, as Zach said, spread the news of why it's important to wear masks, to be vaccinated. From a healthcare standpoint, we focus on the science. Our surgeons, physicians, nurses, rad techs, physical therapists, they focus on science. That's what drives us as a healthcare profession. We look at the science. And the science tells us vaccinated masks, and that's what we do. And from a leadership standpoint, as I look across the room, there are leaders here. People look to us to see what are they doing. Folks are looking at us all day. I have my 3 kids, and I tell them all the time, people are watching you. And if you don't do something right, they're going to tell me. And it's the same thing when it comes to leaders. Folks are watching us. We want to make sure that we are having the best behaviors out there. And from a standpoint of getting information to the community, whether it's about vaccination, whether it's about care visits, whatever the case is, making opportunities for the community to receive that information. Our not-for-profits, nonprofits can do that on a great scale to our community to get their information. It's so vital at this point in time to do that because we're not out there. We're still in a pandemic. There are people coming into the hospital that are sick every day and that they're still trying to get over COVID-19. So things are loosening, which is great. We're seeing that there's a light at the end of the tunnel. Hopefully it's not a train, it's a light. And we're getting better, but we're not there yet. Can't take down our guard. We have to make sure that we let people know. Things get better, we're almost there, but we're not there yet. Wear a mask, get vaccinated.
Okay, thank you both. And this is our final question before we open up for Q&A. Outside of the COVID-19 pandemic, what are our community's most pressing healthcare needs? And how can we be responsive to that?
That's a great question. There are many different processes. For us, behavioral health is a huge concern. It has been for several years now. So as we have said with primary care, we are really making sure that people get care early to make sure it's being addressed. And also to try to remove any stigma surrounding it. You know, there are behavioral health hospitals that are max capacity, have been at max capacity for some time. And we're having to send patients all over the state to find beds for the patients, those who have behavioral issues. There's no stigma behind it. It's a healthcare concern that needs to be addressed. We want to make sure that people are receiving that care. So behavioral health is the first to mind as we see it all the time. And then secondarily to that, it's going to be the education of our children at the youngest age possible regarding the benefits of good health. I know during the pandemic, there's been a lot of shutdown of youth sports, and that's been an impact to a lot of kids, not only physically, but also emotionally, because they need to have that activity level. It needs to start off early when it comes to being healthy, exercising, and the more that we can give to our children in terms of living a healthy lifestyle, it's going to improve their life moving forward and our nation as well. So those would be the two things that really come to mind for me, would be the behavioral health issue, and also, again, the healthiness of our children.
You took my top one as well. So it's so refreshing to know that while we work with each other in different organizations, our priority is the same. So just the amount of stress that we've all felt with this past year's events, magnified with your children that don't have the context or the resiliency, the tools in their toolbox to cope with some of the things that we do, or deal with or think of someone with a pre-existing some kind of issue, think of the stress that has. So making sure that we're there for our community perspective is a top priority. I'll just go back to the other themes that we talked about, access to care. So making sure that we're ready to care for our community, regardless of your ethnicity or your ability to pay. Making sure that we are out there telling the message of care and vaccination, screening, and then doing our part to increase the amount of healthcare workers or things that are going to continue focus for us.
Fantastic. Thank you so much. And at United Way, we believe everyone has a place on the steps to success. And all of those steps start with basic needs, and that is a house over your head, food in your belly, but also access to primary behavioral health care. And you can't make your way across those steps without getting that care that you need on that first basic needs. And that goes to Born Healthy all the way up to college and career readiness, high school graduation, things like older and connected healthy adults. But without the work that you all are doing in our community, without the work that we're doing together in the healthcare space, no one can make their way across that to their own path to success. And so thank you for your input today. Thank you for your answers. I know I could sit here for a couple more days and continue to pepper you, but I think it's the audience's turn. So I'm going to turn it over to Danielle and to the audience as well and see if we have any online questions. Perfect. So if you have a question in-house, there's a mic here. And if you're online, I think we have someone monitoring the chat. There are no questions. I think you've answered them all. This is a big day. I do have some pre-submitted questions. So while you all think of some, why don't I ask some that I've got from already online that we've had submitted? And if anybody thinks of anything, come on up and stand in the queue or type it on in the chat. I see some chats coming through. So how about what does or could partnerships between your organizations and businesses, charities, nonprofits, members of the Chamber of Commerce look like? You've talked about the nursing program. What are some other things that the folks here could get involved in and think about for their businesses or nonprofits?
Jump into that. So during this pandemic, there's been a lot of resiliency building within our there was need for resiliency building prior to the pandemic. And then once pandemic hit, it just heightened for resiliency building. And within our facilities, we are finding different ways of doing that. How can we build resilience, whether it's celebrating, whether it's finding ways to give out some candy here or there, or most recently brought in some massage chairs for our staff, so to speak, to relax and to take a break for 5 minutes before they go back out and take care of patients. So there are many ways. We have a foundation, Mr. Henry, today, and there's a way of making those things available to our staff, because building resilience is a huge deal. And also in terms of bringing in their posters, their postcards, there's so many things that have been brought to our staff from the community, from organizations that have shown the support, has helped them get through another day. Because those things are needed, and the staff, they just love to know that they are cared about. Somebody's thinking about it. So contacting directly with the hospital, contacting us, there are ways of doing that to help us build the resilience of our staff.
I don't have all the answers on this one, but it really, I'm always impressed in the nonprofit sector about just how nimble and how responsive organizations can be to what's happening in real time. And you can change on a dime, you can focus on different things. So I would just encourage organizations to maintain an open line of communication with us. Think of creative ways that we can help solve some of these issues that we've addressed. We're open to welcome any great idea.
Did have one question come in from the chat. Mr. John, I'm not going to try to say his last name, but John would like to know if analysts see healthcare systems getting back to a more normal service line here in 21, service lines that have seen reductions due to the
pandemic. I would say yes. I think we're well on our way there. Our surgery schedules are back to basically full force. Our screens are starting to pick up there. One area that healthcare organizations across the country have seen a decline in is ER visits. So particularly low acuity. So sprained ankle, or, something, some pain in my wrist or something like that. We're seeing that type of visit not coming back to the hospital. We saw a big decline in that as an industry. But that's starting to come back. So the ERs are getting busier, healthcare services getting busier. So yeah, we're definitely.
Just that absolutely, we're back to normal as we're looking at this again. I would say that we're now moving from a era of doing things because of COVID to doing things in spite of it. Because in spite of COVID, we're going to take care. There's been many times where because of COVID, I have to change. Now it's in spite of COVID, this is what we're going to do. We're going to provide this care, these processes, in a way to take care of our patients, in spite of it, because now we have more knowledge of what COVID is. We have a better understanding of how to treat it, how to avoid it. So we now have a better comfort level that allows us to go back to it.
Great, thank you both so much. We did have another question. So Allie would like to know, or she's curious how we can all be advocates for getting the vaccine, as well as expected vaccination rates in rural versus urban areas, and how that will impact public health in our region.
That's a great question. But I'll take a stab at it. I know that our Virginia Department of Health, they're doing a courageous job of getting information out, getting shots in the arms. It's a huge task that they have from, of course, here in Richmond, all the way to far southwest Virginia, where I was before here. We have a huge variety of communities in our Commonwealth. And it's a challenge to be able to get the information to everyone that needs it. Again, the best way to get information out is going to be going person to person. It's going to be by living what you want others to do. It's by living by example. It's by telling folks to wear your mask. I've got vaccinated. Make sure you're vaccinated. Tell your family and friends to receive the vaccination. Let them know that it's healthy and safe to do so.
I think we have to manage misinformation, so we have to get the right information out there to people. We have to be leaders and model behaviors that we want. So encourage people in your sphere of influence, your networks to get the vaccine. You know, I think like any initiative, there's going to be people that first day that they're eligible, they're going to do something. Another group that's going to sit there and make sure that the first people didn't have some kind of consequence or suffer some kind of side effect before they move forward. And then there's going to be people that are going to take more risks. So I think we're probably on the latter half of that second wave of people. In the last bit, it's really hard, but it's worth doing for sure.
I think we have time for one more question, and I see someone in person. He's standing up and been in the queue. So come on up.
Hi, Tammy Shackelford with the Lucy Core Foundation. And I heard a lot of great things today. But one thing I didn't hear about was seniors. We have a growing senior population. They are great users and abusers of your EVs. How can we really improve the health of our seniors so that they're not having to go to the ED? And how can we partner as a community, at least before, say, with a healthcare system, perhaps bring the healthcare to our residents? Another part of that is we have found, even though we have about 70% of our staff that's vaccinated, we're still fighting that for misinformation and stigma. And again, it's coming, but we've now had a couple cases come in where we have people who test positive with no symptoms, both workers as well as vaccinated residents. How do we know that what happens in our community because of the lack of a presentation of symptoms? How do we know we beat this? Those are two big things. Thank you.
I'll take the first part and I'll leave the science question. So first of all, the senior community did a phenomenal job of doing the best they could with the resources they had to keep their residents safe. Once vaccine became available in nursing homes, assisted living facilities, they moved quickly and efficiently, and we saw the burden in the hospital of senior care patients coming to us with COVID drop overnight. Not overnight, 2 weeks after their second vaccine. And that was a tremendous benefit, not only to the residents of assisted living facilities and nursing homes, senior care, but to the healthcare system overall. To your point of how do we coordinate care better, how do we make sure that residents receive the care they need? A lot of that from the hospital perspective is about great communication between our organizations. That's something that we work on a daily basis, right? So if you come receive, one of your residents comes and receive care in Joe's hospital or mine, yeah, the better you tell us the story, the better you document this patient, the better we care for them and make sure that they are set up for success when they go back to your organization. More likely they are not to come back for the same illness or come back for something related, because we've got to the root of the problem, come up with a great plan, communicated that plan well, and your team has executed on that. So that's a tool that I've seen very effective. Great communication, great care coordination.
Just chime in on that. So across the Richmond market, we have close to 100 medical practices. So there are numerous access points. However, from an elder standpoint, it's hard at times to access, even though they're everywhere across our region. So there is where the telehealth comes in, because it's a huge component to bring access directly into our patients. And regarding those that are asymptomatic, I can't really speak a lot to that, but I do know that we need to again focus on the parameters being given from the CDC in the state of Virginia. That's very, very best, just to make sure we minimize our risk by maximizing protection.
Thank you. And with that, this concludes our program. Danielle, I don't know if you have any wrap-up remarks to make, but I want to just say thank you. I've learned a lot. I hope that you all have learned a lot as well. And I'll use my moment of privilege up here to say, don't let the conversation end here on this stage. We're going to walk off and you're going to be able to have those partnerships, to have those connections, and to continue it moving forward. So please don't let this be the only moment that you think about healthcare, and you think about partnering with these organizations and others in your community. Make sure you take it forward into your day-to-day. And thanks for joining us. We appreciate it. Danielle.
I'm not going to make ending comments since we're right at time. Thank everybody for coming. And we did move our lunch 1 week so we could have 100 people instead of 50. So the 19th,